start recording because the topic needs to be
Professor,
picked
um,
by the app. Yes.
before we do so, do you mind allowing me? Well, I mean, you can do it. Do you mind allowing me to? It's because I'm from my computer. Well, I'm from my cell phone right now, but I'm trying to join from the computer.
Oh, okay. Then there you are. Okay. All right.
Thank
So, sure. As you can see here, both of your topics have been included within the list of names that will be used. And this is the Jack in the Box that is going to tell us that your topic is going to be young adults job search, right? Which was, I think, the second topic, the second outline.
The um in regard to this, it's not for us to change it because of course it's not something we will do. But I was just wondering because I didn't know that Natalia's group had kind of
Yes.
like a very similar topic. So
Yes,
I don't
but
know.
mhm.
I was just wondering.
No, it's all right because it is a kind of a different perspective, and I accepted both because precisely the idea was that they were going to be a little bit different. They ended up being very similar, but you do have some ideas that are different from theirs. So um, I think it's just the way it is because this was the result of the raffle. So let's go with it. Okay.
Oh no, no. I mean, it's fine. I just want to like, I don't know how to say it. I just want to make sure
Mm-hmm.
that in case something sounds similar, not because I believe that any of us have tried to plagiar. I don't know if there is a verb of that.
Of course.
Plagiarizar.
Plagiarize.
Plagiarize. All right. I was thinking about
Yes.
plagiarism.
No, it never crossed my mind. Don't worry about that.
Okay. But I mean, in case something sounds similar, it would be fine because it's not that I will memorize or remember exactly the Natalia's speech or group's
Of
discussion,
course.
but of course, since they are very similar, what we will say may be very close to, so it'll
No
be fine.
problem.
Okay.
Okay, I understand. All right,
Okay.
so I'm going to create the breakout room so that you can all go there. And there it is. You
Thank you.
have 15 minutes, so I will see you at 5:06.
you.
Thanks.
Mm.
Okay, see you.
So, well, good afternoon, professor and classmates. Before we actually move forward, I was wondering, have you ever thought about how many people is unemployed? How many people are unemployed right now? Do you have any guess or any idea? Well, let me tell you something. An article written by María Núñez, which is titled 64 millones de jóvenes están desempleados en todo el mundo, and which was published on June 14, 2021, established that at least 64 million of young people does not have a job by July 2021. And 145 million of young people who actually had a job does not live in the best conditions. They are actually poor. So today we're going to talk about the obstacles that young adults face when trying to get into the labor market in Costa Rica. We have divided our discussion into three parts. First, we will discuss about three possible causes that this problem may have. Then we will move forward to the three possible consequences the or repercussions this problem may have if we do not address it soon. And last but not least, we will talk about three possible solutions that the government could do to lens to lens this problem. So I would like to introduce myself. My name is Kenji Quiroz. I will be the leader of this discussion. Here we have my coworker Dana, my classmate Dana Barrientos, and my classmate Danny Caravaca. Sigrid is not here so far, but hopefully she will be joining us soon. So I would like you to first of all note that based on a statistic published on the Barómetro Laboral CR website on the age section, which reference were Ministerio de Trabajo y Seguridad Social and Instituto Nacional de Estadística y Census 2021 to 2022 established that the largest amount or the largest group of people who does not have a job is the 15 to 24 year old group. That's the one who that's the one that maintains the highest unemployment rate at 34.2% by 2022. Then, based on an article which is called Desmedido crecimiento en la fuerza de trabajo agudiza la situación del empleo en Costa Rica, which was written by Johan Umaña and published on June 26, 2019 in the Hoy en el Tech um, magazine or journal, established that the highest levels of unemployment in Costa Rica are also demonstrate also the lack of jobs that we do have here. In the first quarter of 2019, it did demonstrate that the unemployment stood at 11.3%, and it actually increased due to the COVID-19 situation. Moreover, on this same article, it is established that free zones or, well, let me rephrase my idea. This same article established that while companies in free zones, the ones who are located in free zones, may increase their, may expand themselves up to 10% annually, the ones who are not in these free zones may either stay as the way they are or they may actually decrease the amount of people they are requiring. These propose that people who do not live either in or nearby free zones may have a difficult access to getting a job because either they cannot move close to a free zone to get a job there, or within the place they live, there are no jobs that they can actually get. And that leads us to the main question that we have or that we would like to address here. That is, what can the government do to reduce the obstacles that young people face or experience while trying to get themselves into the labor market in Costa Rica? So we would like to talk firstly about what the causes are for this problem. So I would like to hear perhaps Dana. Do you have any comment about what I just said?
Yes, I actually wanted to mention and interrupt you a little bit because I think that one of the main causes of this problem is the fact that now there is an increase in the competitiveness in the job market. So we see this starting when you start your university. When you start university, for example, there are many students that are able to get opportunities like internships or job positions related to their field, and maybe they searched for them or they had some type of connection with the company that provided them that opportunity. So they do have those opportunities do exist, but there are people that do not have these opportunities and that maybe it is not as accessible for others. So that leaves that group of people in disadvantage when they start looking for a job and when they enter the job market. And that also comes along with the fact that newly graduate young adults are now competing with overqualified adults for the same job position. So that could affect them in the fact that those overqualified adults have maybe worked two jobs that are related to that field and that they know and have experience in instead positions. And as the Forbes magazine article called the 2021 employment market and what it means for recruitment in 2021, it was released, and that quote said, recruiting has always been about fit finding, including getting clear about what type of work environment is the right fit for a candidate while making sure they have the right skills and mindset to deliver to the employer's expectations. So that basically tells us that although you may have a good, let's say you graduated from a good university, that does not tell you or secure a job position at a company. You still have to compete with these people that have many more skills. I don't know if Danny agrees or if he has another maybe cause of this, another cause of this problem.
I definitely agree with you. I think that nowadays we have a lot more of yeah, the market it's more competitive than maybe it was in the past. I do have another cause that I think it's relevant for this topic, and it's the lack of work experience among young adults. And definitely that's limiting that young adults have been facing in the last couple of years. Companies now are looking for people that are highly qualified, not only in the educational field, but also who have more work experience. So actually in the article, Desmedido Crecimiento en la Fuerza de Trabajo, agudiza la situación de empleo de Costa Rica by the Tecnológico de Costa Rica, published in 2019, expresses that there is less employment opportunities for those who lack formal education and work experience. And many of these people come from low-income families and struggle to be inserted in the labor market. So it's not just that, these people are not looking for opportunities, but sometimes they don't have the chances. They don't have the opportunity to end their high school degrees, or they don't have the opportunity to go to college. So all of these factors at the end adds up to the fact that they won't have let's say the first opportunity to get a job that it's not requiring having a lot of work experience. So I think definitely this is kind of a cycle that keeps up and continues. So you cannot get a job because you don't have work experience, but companies are not willing to hire you because you don't have work experience. So I definitely think that's something else that is causing this issue.
All right. Thank you so very much both for your comments. Sigrid has not joined us just yet, so we will move forward on this part. But just to do a summary, Dan had mentioned that many students cannot get internships on their fields once they graduate either from university or high school, and that places them on disadvantage with others that either have experience on their field and or have been able to take advantage of those internships. And then Danny also mentioned and actually add to Dana's idea that the lack of job experience that they may be getting is not helping them to get a job because a person or a recruiter is less likely to hire them if they do not have the experience that it requires. And because of that, it's an endless cycle that most likely will not stop to continue. Now, we would like to discuss or explain a little bit about the future consequences this problem may have. Do you have any guess or any comment, Danny?
Yeah, I definitely would like to add something. I believe that one relevant consequence or possible consequence of this issue it's the informal unemployment among young adults. And even though it might be seen kind of a solution maybe for some people, instead of getting a formal job, you get an informal, maybe it's not that bad, but there are a lot of negative outcomes that come with this with informal employment. And one of those is the lack of medical insurance. That's definitely something that young adults, need. It's part of the those requirements that you should ask for when you enter into a company, because incidents happen and you might get hurt while working. So of course it's necessary for you to have this type of services. And not only that, but also the economic instability that comes with an informal employment. It's something that young adults need to take into consideration. Of course, that not having a legal contract makes, there's not like um, or companies are not required to provide with those legal um, I don't know, requirements, let's say. So yeah, that could lead to even poor labor conditions. Actually, the article Formalizando la Informalidad by the International Labor Organization, published in 2015, mentions that lower wages, job instability, precarious working conditions, lack of social security place informal workers as a vulnerable group with severe limitations. So definitely, I think that informal employment could be one of the consequences. I don't know if Dana agrees or if she has any other idea.
Yeah, definitely. I think that my idea is related as well with yours. I think that maybe other consequence that we might be, or young adults might be confronting when they go out into the job market would be the fact that they might be pushed into a job position that is not related to their major or related to their field because of this lack of opportunities, right? So this not only can affect their emotional state, but it also can like decrease their motivation when applying to other jobs or when looking for a job. And although there may be some opportunities for them in their field, it can be really difficult for some. As you said, the amount of informal jobs that are now available in the market is really difficult sometimes for them to find one in their field. So it can be also detrimental, and that's the thing with their mental health and their mental state, because the job conditions and the job hunt stress intensifies. And as Lowe's, Annalise, and Edwin mentioned in their article published in 2019 called by the Journal of Vocational Behavior, there are many predetermined steps and to employment, and job seekers usually get a little to no feedback when they have this rejections and when they enter the hiring process. So it is not surprising that many individuals experience job search as a black hole that swallows their efforts and energy without returning a positive outcome. So I see this related to your idea as well. And I think that it can not only affect them and their mental state, but it can also affect the people that do really want a job in that field that they are working in, because not only are they taking a job position and taking, quote unquote, taking a job position from someone that really needs that job position or that really wants to work in that field, but there is also this let's say mental state that you're contributing or let's say undermining, because you're not adding to what you think you want to do. You want to do other thing, not as, let's say, this was not what you were picturing in your life. So yeah, I think that it can definitely affect them and other people as well. I don't know if Sigrid is here with us yet.
She has not joined us, but thank you so much both for all the information that you provided. Just to do a summary on what you just said, Danny did mention that one of the possible consequences that it may have is that it leads these young people to get informal jobs, any kind of job they may be given, which comes with a lot of negative benefits. They are lacking of medical insurance, so if next day they get involved into an accident, they may not be covered, and also not having job stability because companies are not um they are not required to give them the basics, and because of everything that Danny mentioned and I just summarized, this will place them into the most vulnerable groups because at the end they will not be getting even the basics. Then Dana also add that it may push them to get another job that is not exactly related to what they studied, and this will affect their medical health, their mental health, and will disappoint them because at the end it would be kind of pointless, the studies that they did, just for them to get something totally apart from what they studied. Now, I would like to move on to one of the to our last part, which has to do with possible solutions. So we would like to we would like us to discuss what possible solutions we may have for this problem. I don't know if perhaps Dana has something to add.
Yes, I wanted to add that maybe, and I know this is basically why we're here and why we're discussing this subject, the government involvement in this type of situation and this type of problem. So a possible solution for me could be the fact that we could create more public policies that would ensure a better future for young adults in the job market. So maybe we could involve these entities that do know and have those resources and the information that is related to the job hunt and the unemployment rates. So agencies like ANE, that is the Agencia Nacional de Empleo, or PRONAE, that is the Programa Nacional de Empleo. Both of those entities, basically what they do is they give unemployed young adults resources and information about the job market in Costa Rica. And they also allow them to participate in courses in order for them to continue building their future, basically, until they find a good job position that adapts to them as well. And we could even include the participation of the private sector. For example, we could allow them to participate in the creation of these public policies in order for them to open more job positions and allow the job market to grow as well in Costa Rica. And I know that they have a lot of benefits as well. So that would be good for young adults. And also, I think that with the public policies, what we would like to do would be to create better jobs and jobs that young adults feel comfortable working in. So, for example, in the World Bank blogs, in an article published in 2015 called "Does Competition Create or Kill Jobs?" They say that progress toward better jobs is driven partly by the disappearance of low productivity jobs, as well as the creation of more productive jobs in the short run. So I think that that would be basically a solution that it would start from the base of the problem. I don't know if Danny has maybe a similar solution, or Sigrid is with us.
Well, I do wanted to add that I definitely think that that's something that we should pay attention to. The government also of course, needs to pay attention to this problematic issue and start making all of those changes. I think that I was thinking on something that could be added to your point, and it's the promotion and organization of job fairs for young adults. And I think this is something that could help them too, like a way in which they could find those job positions that fit their professional profile. So a lot of the time what happens is not necessarily that there are not companies that are interested in hiring young adults or young workforce, but there's like a lot of misinformation, and young adults sometimes they don't know about these companies, so and they don't know what to do or where to apply for them. So something like promoting job fairs would be a really good idea for them to narrow down their options and really look for jobs that suit what they are looking for and what they are able to provide to a company. So I think something like this would definitely help. And companies that are willing to, in fact, the article by the International Labor Organization that I previously mentioned in the past section also mentions that providing young people with assets that allows them to overcome the barriers to access formal employment, such as accrediting experience in the workplace itself. It's something that a lot of companies are willing to do. And so companies that are willing to accept, young adults who maybe do not have lot of skills or a lot of work experience might be beneficial for them as well. So they just need to give them a chance. And something like a job fair, I believe it would be a really good idea for that.
All right, thank you so much for that. Now, Sigrid is actually here. We are into the possible solutions part. I don't know if you have something that you would like to add. I don't know if you're able to hear us, so maybe you can share your ideas. And she's left again. That's a pity. But so doing a summary about what Dana and Danny just discussed in terms of the possible solutions. So Dana mentioned that the government should be involved and agencies who actually have access to provide better jobs to people should be a little bit more involved into what they are looking for. They can help them create or develop themselves in different areas so they can actually see what is their profile and knowing also into what positions their profile fits, right? That would help them a lot. And that would also help the institutes knowing what is young people needing so they can actually provide jobs that are according to what young people is looking for. Moreover, Danny also mentioned and add that promoting information in job fairs about companies who are looking for young people could help a lot, decreasing the amount of young people who's unemployed. Because by knowing who are the ones who will most likely hire them, they will have more chances of getting hired. Last but not least, we would like to say a phrase that would make you think a little bit more about this problem. And this phrase was published actually on an article that was published in the Tico Times journal. The name of the article is Costa Rica unemployment rate drops to 17.4%. It was written by Alejandro Zúñiga and it was published on September the 8th, 2021. And it literally says, compared to the same quarter of last year, unemployment in Costa Rica has decreased by 7.0 percentage points. However, the unemployment rate has remained relatively consistent through 2021, which actually proves that even though it's a little bit better than it was used to be before, there is still a lot of things that we should work on. Thank you so much for your attention. And I would like to know before we move forward if you have any kind of question or any kind of comment or anything you may be wondering.
Okay. All right. That was a very nice. So you may begin.
All right. So, physical pain, anxiety, insomnia, arthritis, headaches, and epilepsy. What do all of these conditions have in common? They can all be treated the same way with CBD. According to Dr. Bauer, who is a professor at Mayo Medical University, CBD is a chemical that's found in marijuana that does not contain THC or tetrahydrocannabinol, which is the psychoactive ingredient that you can find in marijuana that actually produces the high. CBD is used for medical purposes. Now, a project for legal cannabis cultivation is about to be a reality in the country. And when that happens, Costa Rica has to be ready to dive into this unexplored market. And it also has to be ready to provide reliable information to the general public in order for them to better understand the market and also the benefits of this product for patients who have conditions that can be treated with CBD. This given that up until now, we still face negative personal biases within the government and like governmental institutions and also society in general. So to illustrate how real this problem is, I'm going to talk to you about 3 points. The first one is the long wait for this project to become a law. So according to Diego Delfino's website, the journalist in 2022, this law was first promoted on May 7th, 2019, and it was approved until 2022. Right, so the second point would be the testimony of Isaac Amador. And we found this testimony, the written piece was by the journalist that goes by AFP. This was written in 2021. We read it in the Tico Times. And Isaac Amador has a 7-year-old kid whose name is Mateo, and Mateo has cerebral palsy, and he suffers from seizures. And his dad treats his seizures with CBD. That actually it's been the best treatment for him so far. But he says that he hasn't found legal challenges, but that he has found challenges with people judging him and asking him why he gives marijuana to his kids, just not understanding the medical side of it, right? The third point that we have is the very public stance against medical marijuana of some public entities and some public experts, let's say health experts. For example, we have on IAFA's website, they have on the official website, they have an opinion written by Orozco in 2021, where they say that cannabis has just no medicinal indication and that we already have scientifically proven drugs to treat this condition, so we don't need it anymore. And then we have the words of a psychiatrist, his name is Luis Carlos Sancho, and he says that all the evidence that's presented on marijuana is very anecdotal and that there is no adequately proven studies, which is a very hard stance against medical marijuana, because he also mentions that this could be a gateway for later approval for recreational use. And he's very concerned about research being done on patients with depression or anxiety or psychotic conditions. So in light of the recently passed bill 21,388, that's the cannabis law for medicinal and therapeutic use and hemp for food and industrial use, we're here to ask a question. So what steps should the government follow to educate Costa Ricans on the positive effects of the legalization and use of medical marijuana? This in order to attack the general public's stigmatization of health-related consumers of this plant. I am Paola Fonseca, and my partners are Israel Conitrillo and Jairo Prado, and we are here to discuss this topic. Costa Rica is a country with endless possibilities, and that our land can grow a vast number of plants and crops, right? But cannabis cultivation has faced a set of limitations in the country that have to do with public perception, and they have not allowed it to become a reality until now. First, we're going to talk about the causes of this negative public perception. And for this, here, I want to hear Jairo. So Jairo, you go ahead.
Thank you, Paola. Now I would like to introduce you to some causes for the stigmatization of medical marijuana or cannabis here in Costa Rica. The first reason that we would like to point out is that there are campaigns that are based on fear. Those campaigns that we have been taught since we were little children in high school or in the school. Those campaigns were pretty much based on fear. These campaigns were originated back in the 80s, where the war on drugs was at its peak. And the thing is that these campaigns were focused pretty much on what would happen to people if they do drugs, but not like from a scientific point of view. It was based on what would be the punishment of them if they tried some of these drugs. And that's the reason why it has been stigmatized in our country since then up to this day. This has mentioned by Matt Berry in his article, 3 reasons why they failed. It was published by the American Addiction Centers, and he says that these programs are more focused on showing the consequences of a person who chooses to do drugs instead of teaching them what are the real effects of drugs to their bodies and how to rehab this population. The second negative reason why the drugs are being seen as something bad, pretty much marijuana and cannabis in Costa Rica, is because there's a lot of misinformation. There was an article written by Ana Alfaro that was about commerce and drug consumption in the 1970s and the 80s, where she created some charts where she evidenced how the media would portray drugs as the main focus when there was something bad going on, and pretty much marijuana and cannabis. And it was contrasted with the same situation happening when the person was under the influence of alcohol. It was like highlighted that the drugs were pretty much the main reason why the person committed this crime, and not that the crime was committed by the person itself. And the word marijuana and cannabis was highlighted in all those news instead of the same news happening when the person was under the influence of drugs. And finally, the third reason that we would like to mention for this is that there's little to no knowledge about this topic. We know that we haven't taught from a fear standpoint of view instead of a scientific point of view what is this bad for us. So pretty much we live also in a biased society that is heavily influenced by culture, by religion, that people that were taught many things from time ago, they don't have kind of higher levels of education. They continue to promote this time of thinking, and they pass it down to the children, so people don't know, or they don't really go after what they need to know to really criticize if this is something good, if the medical use of marijuana is something beneficial, or is as bad as it's being portrayed by the government, the media, and the society as a whole. And those were the main causes for this stigmatization.
Okay, so Jairo, thank you very much for enlightening us with 3 of the causes of this problem of stigmatization. I would like to hear what Israel has to say about these causes that were presented.
Thank you. Okay, I try to explain the 3 future effects. The first factor here is the medical cannabis consumers. They will continue to face labeling in social groups.
I'm sorry, Israel.
Do you hear me?
Yes, but I was asking you about your reaction to what Jairo just talked about.
Oh, right, yes. The cause.
Thank you.
So sorry. I have some problem with the connection with my internet. Yes, yes, I heard my partner Jairo the causes, but I believe the causes in Costa Rica are the same way in other countries. It's the same. Consumptions in illegal conditions, and the for the medical products, for the treatment by these health disorders, I don't know, different medical conditions. But this is the some causes. I believe the causes from the consumptions of the cannabis or hemp, Costa Rica, we have two products, marijuana is the same cannabis, but hemp is the another products. But the causes, according to the Jairo, the consumption is not a crime, but this is a little information we have to explain what is the condition with some patient in Costa Rica. This is my opinion.
Right. Okay, perfect. Thank you very much, Israel. All right. Yes, we've talked about several causes such as the fear campaigns that kids are exposed to or that Costa Ricans are exposed to from early ages. We talked about the known negative way in which the media talks about, reports on and portrays this drug. And then we talked about, or they both mentioned the misinformation that there is just out there. And I think Jairo mentioned that this makes people, users, afraid of repercussions, just the general misinformation that's out there. Now, having looked at what may cause this problem, I would like Israel to please go ahead and help me with the future effects that we could have in case that we don't tackle this situation.
Okay, future effects. Thanks. Okay, the first is the medical cannabis consumers will continue to face labeling in social groups, educational centers, and workplaces, which can affect their mental health and their school and work lives. According to the Matt Reed, he wrote in the Journal of Cannabis Research in 2020. This is a digital website. For instance, vulnerable user of cannabis, maybe they find a reduction stigma with strategies to change society in general, but almost specific groups such as Catholic or Protestant with negative attitude, maybe they don't have good opinion for this. Furthermore, future research on cannabis should empower the most vulnerable people in the community, and they came to normalization the medical products against stigmas to use plants of cannabis in society. This is the first future effects. The second is the structural barriers in access to medical marijuana or hemp. This is the hemp in Costa Rica, hemp, due to personal bias. The same way that happened with the next day pill. I remember very famous this pill in Costa Rica. According to Selena Valencia and other in the article Systematic Reviews Journal 2017, marijuana have some barriers or a lot barriers to use. For instance, despite of lack access to medical cannabis will affect many patients with some medical conditions people find on the illegal market dissolution. But the government need to eliminate these highlighted barrier to accessing at medical products from marijuana or cannabis or hemp. Okay, the final future effects is the potential medical cannabis patients not reaching out to their doctor out of fear of being judged. In the article, the Greenspan, the website for this writer, in order to obtain positive result, patient user of cannabis try to be honest with doctor because he need to real information to suggest the best medical product to them. My advice for patient is to be entirely open and honest with your physicians. You don't be afraid, you be honest.
All right.
Because sorry?
Israel, thank you very much, but we're
All
running
right,
out
that's
of
all.
time and we have to go over the possible solutions. But before going over the possible solutions, I would like to hear what Jairo has to say on the future effects. What are your thoughts on this?
Well, I believe as Israel said, as it happened with the next APO, at first it was not accepted, but people are getting used to it because it's necessary. So I believe the same thing is gonna happen. I don't know if it's the same scale, but because it's not that all people is going to use it, but for the people that see it as something feasible for them, I believe that it's going to be something good for them.
All right, perfect. There you go. So we've talked about labeling in the possible future effects. We talked about labeling. We talked about structural barriers within institutions, and we talked about potential patients missing out, right, out of fear on effective medication, out of fear, right, of being judged. So now that we talked about what could happen, let's talk about what we can do or what the government can do in order to avoid those future effects. So first, I would like to hear Jairo's proposition.
Yes, thank you. Well, my first proposition would be pretty much the same thing. It's related to the same cause that I mentioned before. I think that we need to redesign those programs that are being taught in high school and school for young people so they can know what the true effects of cannabis and marijuana is for them. This is because pretty much having an officer coming to you and telling you what's good or bad and what's going to happen to you, I don't think that that's very effective, and I think that it's not being addressed properly. So I believe that they should consult specialists and scientists that really know about this topic, so they can really teach these young people what they need to know, that if they do it, they will at least know how to do it, how to, well, to do drugs responsibly, so people wouldn't be as misinformed as they are for taking drugs, excuse me, marijuana or cannabis
All
as
right,
medicine.
perfect. Now, Israel, I would like to hear from you.
Yes, in addition, this is a good formula to find solutions in opposition, stigmas, and social barriers. People can learn about cannabis and his alternative uses to control the pain. But my recommendations or possible solution is televised informative panel discussions held by health ministry experts on the topic of medical marijuana or hemp, market and science behind the plan for medical purposes. Let me see. These informative panel discussions in broadcast or radio, on the radio or in the social media, with Ministry of the Health and addition with congressmen to explain to the public what is the medical uses of this plant. Cannabis in Costa Rica has different barriers, but this is a solution. All right.
Yes, thank you very much. Perfect. Now let's go with Jairo one more time, right? To provide another solution. And we have only like about 4 minutes. So we're gonna have to hurry up.
Okay, yeah, not a problem. So, well, I also believe that we need to inform people as the same as Israel told us, but I would like to address it as well from an economical point of view. Producing marijuana for medicine purposes, it's something that we could also help our country, excuse me, to boost our economy. I believe that is a new market that it has not been explored yet. And as you mentioned at the beginning, we have a lot of, we had a country that we can grow pretty much anything. So we can harvest a lot of it and it could be a really good business and could generate jobs and help us from the economic point of view as well.
Mhm. But Paula,
Yes.
the target of this campaign is the people who use cannabis for medical purposes. Why? Because the information is organized in order to explain the importance, the discipline, and consistency, the quality in the products from cannabis. This is important.
Yes, it is very important. Thank you very much for your participation. Also, Israel, you're right. It's very important to highlight. Now, again, because we don't have that much time, I'm gonna summarize what we've talked about. Right. First of all, we just talked about possible solutions like redesigning the school programs and holding televised discussion panels, and also investing in nationwide informative campaigns, right? But we went over, first we started by painting the picture of the problem, and then we talked about the causes, which we now have to do with like educational system, right? What we're taught, and media, and the way that it's that this drug is portrayed, and then we talked about just general misinformation. With future effects from this problem, we talked about, more labeling, we talked about structural variants, which they already face, but, continue to facing this within legality, right? And then we talked about potential patients missing out on legal medicine, right? We went over the possible solutions that we just talked about. And now we are going to wrap up. We're gonna mention this information by the cannabis statistics site, which is called FlowHub, that says that globally cannabis sales increased to $31 billion in 2021 alone. So Costa Rica is about to join this market, which is really exciting. But we have to join this market in a way that educates our general population on the benefits of this industry and this product, and the benefits that it has for the lives of so many, and not just the country's economy.
Mhm.
Thank you very much, you too, for your participation. It was a really good discussion.
Okay, thank you very much. I'm going to stop